Yeah, I think he might be joining, but if he's running a few minutes late, I'll send him the recording after the session.
Okay.
Yeah, no sweat. Well, good. Well, why don't we get started just to be respectful of everybody's time. So welcome to the October US ENT Supplier Spotlight. Each of these is always exciting and motivating and a call to action, and I have no doubt that this one will be all of those and then some. We're joined by Keith Barthold of DKB Innovative. DKB is our cybersecurity IT partner, or exclusive one within US ENT. And I think after hearing Keith and talking about his team, you'll see why, out of many choices we had, that we chose DKB. You know, I always like to explain a little bit about why we even offer a certain good or service within the GPO. And this one, I admit, you know, as a physician in a small practice, my inclination before meeting Keith and getting to know DKB was that ransomware and these cyber attacks in the healthcare system happened to someone else, happened to much bigger organizations. That we were such a small fish with my, you know, small suburban community practice in North Dallas that surely this didn't apply to me. And it really is quite the opposite. We, you know, ENT practices that are 5, 10, 15 physicians have a plethora, an absolute gold mine of data that these cyber terrorists, which they are, would love to have access to. We have so much patient health information. We have their credit card numbers, their social security, to absolutely wreak havoc. And not just from a standpoint of protecting our patients and their information, but even one breach can financially cripple or even bankrupt a practice, with the ransom that you might have to pay to get your data unlocked, and then the fines that you may be subject to from our own federal authorities for not having the proper safeguards in place to begin with. And so even though this is a short 30-minute or less talk, we want to hit on all those topics. And so again, a little bit about Keith. Keith is here in the Dallas area and a veteran of technology solutions, spent many years at one of Ross Perot's companies called Perot Systems before that was absorbed by Dell. And specifically there worked with a large tenant healthcare system, implemented EHR and electronic practice management and security in hundreds of hospital systems and practices throughout his time there, and really cut his teeth learning the importance of cybersecurity during that time, and formed his own company roughly 15, 20 years ago, and does this now full-time on a large scale. We're also lucky to have him, and the reason we're having this at a little bit of an unusual time is Keith just finished presenting with the FBI on this very topic at a cybersecurity conference, so obviously he knows what he's talking about. And we'll be presenting a little bit later this afternoon. So Keith, thank you for your time. It's very valuable, and with that, I'll shut up so you can kind of describe your company and the issues, and then we'll just go back and forth on some dialogue.
Yeah, well, thanks for the introduction, Keith. As you mentioned, here in Dallas, presenting with the FBI, specific to financial services industries, and their industry is starting to be rocked a little by these FTC safeguards. Basically, what healthcare has seen for years with HIPAA and high tech, some very prescriptive safeguards that need to go in place to proactively prevent damages from cyber criminals, the things that we're seeing. And I think it's probably an area where we're going to see more and more of that reform hit all industries, probably healthcare included. As Keith mentioned, the data that practices have is a gold mine for bad actors, for hackers, and for multiple reasons, right? With financial services, a lot of that is specific. Like if I can get into a bank account, there's money there. Well, so what if a hacker gets into health records? Uh, you wouldn't think it would be as valuable as it is, but it truly is valuable. And part of that is the amount of regulation around it. We're finding now that ransomware is not only encrypting that data and then having you either pay a ransom or recover from backups, but now it's stealing the data, exfiltration, and that just changes the game because now you're motivated to pay that ransom. You're under duress because it's not just about restoring a backup, it's about then forensics having to occur and very costly, time consuming forensics to determine whether that data was stolen and whether then you're going to be responsible for reporting this to OCR, Health and Human Services, uh, patient notification, civil suits, all of those things. And so the hackers have really adapted their game to not only encrypting but also stealing the data, uh, which just makes the situation that much worse.
Oh, yeah, and this is what you've impressed upon me, but just to clarify that, for most of us that have been in the dark about this, what percentage would you say of these targets are aimed at healthcare entities? Of all cyber attacks, ransomware, those kind of things?
Yeah, I would say hard to say, but you're looking at probably real close to 50%. There's a lot of stats flying around, but if you think of all of the industries out there, and I would say look, financial services is one that's pretty mature, right? You've trusted your bank and used an ATM and used electronic funds transfer for a long time. I think healthcare is catching up. EHR. I was, as Keith mentioned, working with Tenet Healthcare and took about 150 practices, 700 providers from paper to electronic medical records. That was 15 years ago. I'd say that's still fairly new, right? But I think with that, there's still a lot of catching up in terms of maturing the systems and making sure that you have the safeguards, you have the controls and defenses in place to stay ahead of the hackers. It's sort of a race. In healthcare, we've got to harden the attack surface faster than the hackers can get in. And where your banks, where Department of Defense and some of the government entities have been at this for 30, 50 years, here in healthcare, we've really only been at it about, call it 15, maybe 20 years. But you also now you've got so many work from home and telemedicine and the HIE and e-prescribing, and there's just a lot more use of EPHI. And for every modern convenience around electronic medical records and all of these controls, just presents one more opportunity for the bad guys to attack. And so you just got to stay ahead of it.
Yeah, and as you said, I mean, obviously the Department of Defense and those are in banking, those are very important institutions to protect their data. But the reason a healthcare entity feels so much extra duress, I like the word that you used, is because not only do we have potential to pay $1 million, $2 million, $3 million ransom to get our data back, but then we have all the potential penalties, fines, civil suits, the cost of reporting it. One of the hospitals that I operate at had a breach several years ago, and we spent as a hospital millions of dollars just on the notification and getting everybody basically a personal ID, fraud alerts that had ever been a patient at the hospital. I mean, we run thousands of patients through there a week. And so, again, when you think of it, just a 4 or 5, even, some of our practices in USENT are 50 or 100 physicians. When you start talking about millions and millions of dollars, it can absolutely bankrupt us. And so I think that's where I wanted to kind of steer this, Keith, towards what the heck can we do ahead of time? And why is it important for us to have a plan in place beforehand, not just have an adequate, capable IT service like you, but let's talk about cyber insurance a little bit, cybersecurity insurance, and talk about where along the way do we need to engage with an attorney that has experience in defending healthcare entities against these fines and penalties and civil suits. Where, I guess, as you've educated me, does that attorney-client discussion and therefore privilege need to start?
Yeah, so you bring up a lot of good points. I think the time for having cyber insurance is really now. There's not been a more important time to have that in place. And part of that is, regardless of how robust your controls are, of how much work you're putting into this in securing your systems, there's no safe that is uncrackable. We know this, right? And also, there's a balance of understanding how secure is secure enough and how much you invest. Obviously, putting all of your profits and reinvesting completely in cybersecurity instead of reinvesting in patient care would be a huge mistake. But it would also be a huge mistake to treat your practice like Joe's tire shop. No offense to Joe in his tire shop, but he just doesn't have he doesn't use IT like you do, and he doesn't have the data, and he doesn't have the regulation that you have to deal with. And so there's a happy medium and where you figure out how secure is secure enough. Even with all of that focus, and even if you get that dialed in, one wrong move by your staff or one very aggressive attacker could hack your system. I mean, you think about a lot of these attacks are nation state, and it's not that they're picking up on US ENT or any other practice and going, I'm going to target you, I'm coming after you. It's a shotgun approach. They're sending out millions and millions of phishing emails and network scans and doing attacks, trying to get a fraction of a percent to fall victim. But if you can send out millions and millions of attacks and you can get, $1 million on a very small investment on their part, then it's a win for the hacker. And so keeping that in mind, that's why you've got to have cyber insurance there as that backstop. And I know today, Keith and I talked about this earlier, cyber insurance is a lot like health insurance, right? Or not health insurance, rather, life insurance. You're in your early 20s and you're in marathon shape, and you test out and you've got the best athletic health ever. So life insurance is going to be cheap, right? It's going to be easy to qualify and real cheap. If you've got a number of health issues, you're a little bit older, your diet is not well, you're not exercising, you're going to have a really hard time getting life insurance. And if you do, that coverage is going to be low and it's going to be very expensive. And it's the exact same thing that we're seeing, especially now with cybersecurity, is that if you don't begin putting these controls in place, putting multi-factor authentication in place, training your users, putting in a information security plan in place, then cyber insurance carrier is not going to cover you because you're high risk. And the actuaries realize that if you don't put these controls in place, there's a high likelihood you're going to get hacked. You're going to hit with ransomware. They're going to have to pay out, and they're just not going to provide that coverage.
And as you kind of the further to that point is, if you do find yourself having a breach, whether you did or didn't have insurance, the government is also going to take that into account when they're talking about penalties and fines, right? That you were negligent, I think is the word you've used with me.
Correct.
In putting anything in place, even something as simple as telling your staff to not open attachments from senders you don't know, something as simple as that at least is better than nothing. So I think, yeah, the key that you've stressed to me and some of our other practices is being proactive, having a plan in place, including the right IT provider, the right insurance, and planning for it as an inevitability, and know how you will respond when that does happen.
That's absolutely right. And a lot of people don't think about, like, they think about all of the prevention and all the protection. That's very important. We are a company that is foundational on the proactive aspects of IT and cybersecurity. You do everything you can. Same in healthcare, right? You focus on wellness. You don't provide healthcare by just being the ER. We don't want to be the ER IT wise, and we sure don't want to be the ER security wise. But you got to think about, well, what happens when I do need the ER? What happens when ransomware hits, or we get hacked? Or there's signs that there's been an intruder in the house. You need a plan. That's called an incident response plan and a recovery plan. And I would advise that one of the first steps on that plan would be contact your attorney. Have that relationship with that attorney. And the reason why is you want to establish that confidentiality, the client attorney privilege, and establish that confidentiality right up front. That is going to pay dividends when it comes to, if it comes to civil suits later, or it comes to audits and pressure from the OCR. You're going to want to have that, and have that protected, and have that guidance provided by an attorney. And then the second call is probably going to be your insurance company to make that claim if it's major, right? I was maybe well, let's say it this way: probably the third call. The first call, the attorney. Second call is, or in parallel, is working with your IT provider to try to determine, right, is this a false alarm, or this is a code 3, like we need to shut down systems, and we really need to lock things down and think about our communication and think about recovery. Once that determination is made that, hey, this is a big deal and this is a legitimate security event, then that's where your cyber insurance gets involved. And by having that cyber insurance, they're going to make sure all the right people are engaged, be it public relations, be it your compliance attorney, which may be different than your general counsel, and then your recovery teams, forensics, all of the people that need to be involved, because it's complicated. You're not going to know that yourself. The important thing is to have a high level plan. Who do I call? When do I call them? Your cyber insurance company and your attorney, they're going to know at what point do we need to involve the FBI. But have all that planned out. It's much, much better to have an event and to sleep at night knowing that if something happens, I'm just going to follow the plan, versus, wow, it's fire alarms going off and we're just running in circles. We have no idea what to do, which is going to affect patient care, right? If you don't have a plan, then you're scrambling. You're not able to do your job and take care of your patients. You're too busy scrambling versus following the steps.
So to reiterate that then, so you would advise first call is to your attorney. Now, is that your general counsel, or would you, I guess, in other healthcare entities that you work with, do they retain counsel that is skilled specifically in defense of these kind of breaches and the potential problems that arise from that? Or is it good enough for us to have this discussion about our response plan with our practice's general counsel?
I would say that build your incident response plan, and right now have that conversation with your counsel to understand how equipped they are to handle a security event. And I will say, right, we wouldn't want your practice to cry wolf and pick up the phone and call your attorney every time somebody thinks that somebody's in their email, or somebody thinks that hey, I've got a forced password reset, or I got a phishing email that came in. Make sure it's a real event and work with your IT provider. This is certainly what we do with all of our clients, is look at it and do some initial investigation to go, is this real, or is this a false alarm? Or is this a little thing, and hey, I got one computer that's got a virus, I need to clean it up, not a big deal? Or is this symptomatic of a major attack? If it's major, then work with your attorney. But it was a great question, Keith. I would determine now whether your attorney is going to be equipped for this, and if not, maybe get a recommendation as to who a good breach cybersecurity attorney is. You may get a referral. It's certainly not anybody you need to put on retainer or anything like that. That's not what I'm saying. But let's identify who that is.
Right, and start the relationship so you have a prior attorney-client privilege. I've heard you say that a couple of times. That's going to be critical, rather than being reactive and trying to put all this in place after a breach. Everything that you do ahead of time makes the practice that much more defensible, especially in civil suits and things. Again, I'm not trying to give legal advice, but I've had many professionals, including you, Keith, tell me that. Can you talk a little bit, we're just running out of time. This is such a huge topic, but another thing that you talk about with me all the time is password hygiene, right? So I literally was sitting in the hospital yesterday, annoyed that it's been another 90 days and my order entry system required a password reset, and now they're very complicated passwords, but it can't be anything like the one I used the last 90 days. I can't just flip the order of 2 digits. And so why is that hassle so important? Talk to us about password hygiene.
Yeah. So it's important because of a specific attack called credential stuffing, which is basically the bad actors, the hackers out there, are capturing passwords from data breaches. We've seen Uber in the news a few times now, right? So let's think about it. Let's think about, Keith, if your Uber account password is the exact same password that you use on your EHR, is the exact same password that you use on LinkedIn and Office 365 and at the bank, right?
Yeah.
Think about how dangerous that is, because what happens when a major security compromise such as Uber occurs, those passwords are stolen, and then there's a sell of those passwords, typically on the dark web. There's an exchange of the passwords, and then they're going to try everywhere for every Keith Matheny account, K Matheny, different your email address, try different usernames that are going to be common, and they're going to try all of those systems. And a lot of that's automated. It's not even a manual thing. They put it in the system, and it is just going to blast, and it's going to attempt all of these logins at once. And so if you're using the same password that was compromised in one area, it just allows them to jump to the other areas. So very important that you use different passwords. Use a password manager, like a LastPass or a KeyPass, a system. And to have that, I would even recommend, like, have that professionally set up. Use an IT provider like us, like DKB Innovative or others out there, maybe your IT staff, to set that up, and train all of your employees on not reusing passwords and using long passwords, different passwords for each system. And then most importantly, on top of that, I'll kind of segue into multi-factor authentication. So in that example, right, even if Keith used the same password on Uber as he did on his EHR, which would be a terrible mistake, but even if he did that, and he had multi-factor authentication on all of these accounts, even if that password was stolen, that hacker could not get in without having his phone, right? If the MFA code is texted, or an application like Microsoft Authenticator, right? So it's just an extra layer of protection. And at this point, I would just say, look, if you have Office 365, if you have Google, if you have any externally available email, or you're using VPN or any remote access, you absolutely must put MFA in place. I can't stress that enough, because it is not a matter of if, it's a matter of when your password will get stolen. It just happens. But having
Yeah.
MFA is a great additional layer.
Well, we have just about 4 or 5 minutes left, so I want to make sure we open it up for any questions. So please feel free to use the chat function. We're all friends here, so you can turn your microphone on and ask Keith a direct question. But while people are thinking of that, so in summary, it is not just enough. Well, first of all, backing up, being a small medical practice does not make us immune to major cyber attacks. Ransoms in excess of $1 million are common. They're the rule. Furthermore, when we have those types of data breaches as a healthcare organization, we are subject to all other types of penalties and fines and civil suits from each one of the patients whose data was breached. So just think about that for a second, and how quickly that can bankrupt someone professionally and personally. Then the next thing is, if that's the case, then it is critical to have an IT provider for your practice that is skilled in building the defense, several layers of defense against these types of attacks, as well as to have cyber insurance in place proactively, as well as a discussion with your general counsel at least. And if she or he is not comfortable defending these types of cyber attacks, at least have a reference and establish an official relationship, sign an engagement letter with that attorney that would be defending you in the future. Then internally, it's critical for all new hires and existing staff to understand the basics of not clicking on attachments you don't know where they came from, of having different passwords for all of their devices, and having your IT provider put in place as much multi-factor authentication as possible. Certainly if you're using your EHR like most of us do remotely at times, whether it's on our handhelds or our desktops, but doing our charts, my favorite thing to do at night at home, that's a very vulnerable process without the multi-factor authentication. The same thing that we have in place for us to prescribe narcotics now. That gives us a lot of protection. But again, all of these bullet points are necessary if and when, and probably most of us at some point will suffer some kind of attack, or at least one of our hospital systems will. To have all this in place at least gives us some ground to stand on, that we did everything we possibly could ahead of time.
That's right. It's a lot of information. I know it's overwhelming, but just little steps at a time, right? Just having some of this basic foundation in place that you can build off, start somewhere, and that will keep anyone from saying that you were negligent, right? And that negligence is a big deal for OCR and the authorities, and for civil cases to say, look, you will not be able to avoid being hacked 100%. You can be hacked, but if I put all the controls in place to reduce the damage and reduce the risk, that's what we're looking for here.
Perfect. Okay, anyone have any questions for Keith? He's got to run. I know everyone has busy clinic days and things. Again, thank you for attending, and thank you for all of the people that are watching this at some point in the future on a recording. If you'd like to find out more information, and I hope we all made the case that it's necessary for all of us to find out about these topics, please reach out to Julia or myself or any of the US ENT team members. Specifically at DKB Innovative, the contact person will be a young lady named Michelle Kulik, who is unbelievably sharp. She's my contact person here in Dallas. And so Julia can circulate the email and the contact information for DKB. But again, they are the sole source IT provider for US ENT, so you would be able to take advantage of all the US ENT benefits should you choose to partner with DKB. Well, Keith, thank you so much for your time and fitting us in between the FBI and all these other really important organizations. You've scared us to death, but that was the point, to motivate us to actually protect our practices and protect our patients. So thank you very much for your time.
You bet. Thank you.
All right. Have a great afternoon, everybody. Take care.
Bye, y'all.
Thank you. Bye-bye.